Gastritis, you heard it before, I heard it before. It's time for us to understand our stomach's defense failure. It is very important now. Gastritis is not just too much acid. It happens when our stomach's natural protections fail. Now remember, normally our stomach holds acid strong enough to digest protein but avoid self-damage thanks to a thick mucus layer, bicarbonate buffering, tight epithelial functions, steady blood flow, and prostaglandins that support repair. It is very important now when these defenses weaken, acid penetrates the lining, causing irritation, inflammation, and sometimes bleeding. It is very important now. Let's talk about acute gastritis. This develops very quickly. So NSAIDs like the ibuprofen, they reduce prostaglandins. They also lower the mucus production and the mucosal blood flow. Now, alcohol directly injures our lining. Also, severe stress like the trauma, sepsis, burns, they can reduce stomach's perfusion. This causes ischemic injury. Now, patients may report burning, epigastric pain, nausea, vomiting, or if the vessels are exposed, they may go through something called hematemesis or black stools. Now, let's talk about the chronic gastritis. Now, this is slower but more serious and long-term. The most common worldwide is the Helicobacter pylori, also called H. pylori. Now remember, H. pylori survives in acid by producing urease and triggers ongoing immune activation, gradually damaging our glands. Acid secretions may decline and the lining can go to atrophy. Now, in some cases, our cells change form. It goes to intestinal metaplasia, also increasing the risk of cancer. So, autoimmune gastritis targets parietal cells and intrinsic factors. It reduces vitamin B12 absorption and possibly leads to pernicious anemia. Symptoms vary from every patient. Now, some patients feel the burning, early fullness, or bloating, whilst others have no symptoms at all until anemia or bleeding definitely occurs. Let's talk about the management. Remember, management focuses on restoring balance. We need to remove triggers like the NSAIDs or the alcohol. We need to suppress acid with proton pump inhibitors or H2 blockers and eradicate the H. pylori when present using combination antibiotics. Now, the goal is very simple. We need to heal the lining before inflammation progresses to ulcers, hemorrhage, or long-term structural damage. Now, gastritis is a problem of protection first, bleeding second. So understanding it this way helps us recognize early signs and prevent complications. We need to always help educate and teach each other. Our knowledge is more important than everything. We need to learn more about our health daily. I'm going to see you soon. My name is Larry Salom.